blood requisition process starts from receiving the physician's order. It cannot be given without a written request.
Check the doctor's order for completeness. Carefully compare the doctor's order with the blood request form. Ensure that the blood request form is completely filled up with the correct patient name and correct medical record number, patient contact number, attending physician, clinical diagnosis. If patient is for surgery, take pre-op and specify. Write the expected date of transfusion and specify if it is start as soon as possible routine. Take cross-match. Write the blood type and blood transfusion consent sign must be ticked. Ensure that the physician indicate the reason for transfusion. For packed red cell, the amount in units, the hemoglobin, or the hematocrit. For fresh frozen plasma and platelet, the same thing also will be done. And make sure that the doctor ordered, signed, and stamped together with the date and time. Make sure that 2 registered nurses will sign and stamp the blood type cross-matching sample with the date and time.
A patient for elective blood or blood components transfusion, a properly labeled blood specimen shall be collected. It is a lavender top with at least 4 ml blood to be extracted. Specimen tube to be labeled properly with patient's name, MR number, the collector's initials, and the date and time the specimen was collected. It is then to be placed in a biohazard bag with an insert of the hard copy of the requisition and the blood bank request form. This is how we order the requisition for pack RBC and platelet on the Oracle. From the Oracle, log on your ID number and password. And click on the Inpatient Order Fulfillment or CPOE. Enter the unit number on where your patient is admitted, or you can just directly type the MR number of the patient and search. Click on the name of the patient to whom you want to do the requisition, and on the left corner of the screen, click Order. On the upper portion, click the tab of Laboratory and make a new request. Enter the clinical history and typed packed RBC. Quantity, and just in case you want to add additional information like divide the blood into 4 bags, type it at the additional information bags. Review and post, then print. For the platelet, make a new request Make a new request. The clinical history. And type platelet. The quantity. And additional information if there is. Review and post, then print.